Hi, I'm Dr. Kevin Haney. I'm the Medical Director of Ozark Regional Vein and Artery Center. Today we're going to talk about vein stripping and why we don't do it. We get asked a lot about vein stripping. Many patients come in saying my mother had stripping, or even they had stripping many years ago. And they want to know what's different now, what's better now, what makes it easier now than what their mother went through, because the recovery time with traditional vein stripping was very long, measured in weeks. So just a quick review of the anatomy. The great saphenous vein is often the culprit with varicose veins. It starts in the groin, it runs all the way to the ankle, so it's a very long vein. And so the goal of stripping was to put you to sleep, make an incision, typically in the groin, dig down to the greater saphenous vein, depending on how deep it was, or depending on how big your leg is, and they would tie that off and they would try to remove it or rip it out all the way to the ankle. And so people would have to be under anesthesia for that. They would often have to stay a few nights in the hospital. They would probably have to be off work a few weeks, and they would have huge scars and a lot of pain in the recovery process that went on for weeks. Our treatment alternatives to stop the flow in the greater saphenous vein that we use here at Ozark Regional Vein and Artery Center are usually minimally invasive. Many are performed through a needle puncture, so you don't have sutures, you don't have long recovery time. People get up after the treatment and go back to work or go back to life as usual. Ways you can do it are the thermal types. Thermal would be involving a laser or a radiofrequency device, and then there's the non-thermal types. One of them would be cyanoacrylate glue, it's called VenaSeal. Another would be Varithena, which is an injectable. So insert a small needle in the vein and you inject this white foamy material. It looks like shaving cream. The whole process takes just a few minutes and you get up and go about your business. If you feel like you have vein disease and you're interested in a consultation to see what your treatment options are, please go to our website, fill out the screening quiz, or make an appointment.